Hello and welcome. Today, we're diving deep into a condition that can silently affect hearing and balance, especially in infants: cytomegalovirus, or CMV, induced inner ear damage. This often overlooked complication can have significant long-term consequences, and we're here to shed light on what it is, how it happens, and what can be done about it. So, what causes this inner ear damage? The culprit is cytomegalovirus, a common virus that infects people of all ages. Many adults are exposed to CMV at some point in their lives, often without even knowing it. However, the real concern arises when a pregnant woman contracts CMV, especially for the first time. This primary CMV infection can then be transmitted to the developing fetus in utero, leading to congenital CMV. While not all babies born with congenital CMV experience problems, a significant percentage will develop hearing loss and other neurological issues, including damage to the inner ear. Now, let's talk about how CMV actually damages the inner ear. Once the virus enters the fetal system, it can target the delicate structures of the inner ear. The exact mechanisms are still being researched, but we know that CMV can directly infect cells within the cochlea, the hearing organ, and the vestibular system, which controls balance. This infection triggers inflammation and disrupts the normal development and function of these structures. CMV can also lead to the formation of scar tissue within the inner ear, further impairing its function. The resulting damage can affect both hearing and balance, leading to a range of auditory and vestibular problems. Understanding how common CMV-induced inner ear damage is crucial. Congenital CMV infection is estimated to affect between 0.2% and 2.5% of all live births globally. Of these infants with congenital CMV, a significant proportion will develop hearing loss, making CMV the leading non-genetic cause of childhood hearing loss. The prevalence can vary depending on geographic location and socioeconomic factors, with higher rates often observed in areas with lower socioeconomic status. The signs and symptoms of CMV-induced inner ear damage can vary greatly from baby to baby. Some infants may have obvious hearing loss detectable at birth, while others may pass newborn hearing screenings only to develop hearing loss later in infancy or early childhood. Other symptoms can include delayed speech development, balance problems like frequent falls or difficulty walking, and even visual impairments in some cases. Because these symptoms can be subtle, early detection through screening is crucial. Diagnosing CMV-induced inner ear damage requires a multifaceted approach. First, all newborns should undergo routine hearing screenings. If a baby fails the hearing screening, further audiological testing, such as an auditory brainstem response (ABR) test, is needed to determine the extent and type of hearing loss. To confirm that CMV is the cause, blood or urine samples from the baby can be tested for the presence of the virus. Furthermore, advanced imaging techniques like MRI can help visualize the inner ear structures and identify any abnormalities that may be related to CMV infection. While there aren't distinct classifications or types of CMV-induced inner ear damage per se, the severity and nature of the damage can vary significantly. Some infants may experience mild, progressive hearing loss, while others may suffer from profound, irreversible deafness. The damage can affect one ear or both, and it can also involve both the cochlea and the vestibular system. The degree of vestibular involvement also varies between affected infants. Unfortunately, there's currently no cure for CMV-induced inner ear damage. However, early intervention is crucial to maximize a child's potential for communication and development. Treatment typically involves hearing aids or cochlear implants to improve hearing, as well as speech and language therapy to support language development. Vestibular rehabilitation therapy can also help children with balance problems improve their coordination and stability. Antiviral medications, such as ganciclovir or valganciclovir, may be considered in some cases, particularly for infants with severe congenital CMV infection, but their effectiveness in preventing or reversing inner ear damage is still under investigation. Prevention is key when it comes to CMV. The best way to protect babies from congenital CMV infection is for pregnant women to practice good hygiene. This includes frequent hand washing, especially after changing diapers or contact with young children, avoiding sharing food, drinks, or utensils with young children, and being aware of CMV risks if working in childcare or healthcare settings. While a CMV vaccine is not yet available, research is ongoing to develop an effective vaccine that can prevent CMV infection in pregnant women. The prognosis for children with CMV-induced inner ear damage can vary widely depending on the severity of the hearing loss and the extent of vestibular involvement. With early diagnosis and intervention, many children can achieve good communication skills and lead fulfilling lives. Research is actively exploring new treatment options, including gene therapy and targeted antiviral therapies, to potentially repair or prevent further damage to the inner ear. Understanding CMV and its potential impact is crucial for parents, healthcare professionals, and researchers alike. By working together, we can improve the lives of children affected by this often silent condition.